This video will focus on what to expect when you go home after your delivery. Whenever you get home, things will be very different. If your baby goes home with you, you will be waking up every 2 to 3 hours to feed or change your baby, and you will likely be very tired. This can be very overwhelming if you don't have anyone at home to help. On the other hand, if your baby is in the NICU, you may be traveling back and forth to be closer to your baby. This may be very stressful for you as you worry about your baby's health. Our new Women and Children's Hospital NICU provides private rooms so parents can stay overnight with their babies whenever they choose. There is also a 24/7 camera to check in on your baby when you can't be at the hospital. In both of these situations, you will be spending a lot of time caring for your baby. However, it is important to continue to care for yourself as well. There are a few reasons to come back to the hospital or call your doctor after you go home. This discussion is meant to help you understand what is normal and not normal in the postpartum period, and it is not meant to scare you. The following 7 warning signs signal something is wrong and you should seek immediate medical care. The first warning sign includes headaches and/or changes in vision. You need to seek medical care if you have a headache that will not go away with medications or fluids, or that worsens over time. This headache is especially worrisome if it starts suddenly, like a clap of thunder, or feels like the worst headache of your life. Other concerning symptoms include vision changes, dizziness, or high blood pressure. Untreated high blood pressure may cause a stroke, which could have symptoms of one-sided weakness, numbness, or difficulty speaking. If you have any symptoms like this, we recommend coming to the emergency department as soon as possible or calling 911. Another kind of headache can occur after an epidural. This type of headache is worse with sitting up or standing and improves with lying flat. This type of headache can also be treated with a procedure in the ER. Another warning sign is trouble breathing, which includes shortness of breath that gets worse over time, feeling like you can't take a deep breath, or shortness of breath when lying flat. These are worrisome, especially if combined with one-sided swelling in your hands or feet, chest pain, a rapid heartbeat, high blood pressure, or fever. Pain or tightness in the center of your chest, especially if it travels to your back, neck, or arms, may be a symptom of a heart attack. If you have shortness of breath or chest pain like this, we recommend being evaluated in the emergency department as soon as possible. The next warning signs are related to persistent dizziness, fainting, and/or tiredness. Dizziness and fainting may represent low blood levels or problems with your heart or lungs. If you pass out or have shaking of your arms or legs, this could be a sign of a seizure. This is especially worrisome if you have any history of high blood pressure. If you have any of these symptoms, again, you should be evaluated in the ER as soon as possible. Overwhelming tiredness is another concern. You will definitely be tired when you go home with a new baby. That is completely normal. However, if this tiredness does not improve after sleep or is preventing you from doing your normal activities, this is not normal. This type of tiredness may be caused by low blood levels. Excessive tiredness may also be a sign of depression, especially if it is associated with decreased interest in things you used to enjoy or not feeling joy with your new baby. If you are concerned about any of these, please call your clinic to make an appointment. Another reason to seek medical care is if you have a temperature above 100.4 degrees. A persistent fever postpartum should always be evaluated. Your pain postpartum should improve each day. So if you have new or worsening belly pain, this is not normal. There are many causes for belly pain, but if it doesn't go away, you should be evaluated as soon as possible. If you experience severe nausea and vomiting, reach out to your doctor or seek medical care. After delivery, you should be able to eat and drink normally. If you cannot keep food and water down for more than 24 hours, you should definitely be evaluated. The next warning sign can be difficult for some people to talk about, which are thoughts of wanting to harm or kill yourself or your baby. If you start to feel sad and hopeless, like you are not good enough, like you do not have control over your life, or you find yourself worrying all of the time, please reach out for help. The next warning sign is swelling, pain, warmth, or redness in one of your legs or arms. Some swelling in your arms and legs can be normal postpartum. However, if this is one-sided, it may be a sign of a blood clot. It is important to be evaluated as soon as possible because if untreated, this could lead to a blood clot in your lungs. Please pause the video to scan this QR code to visit the Alliance for Innovation on Maternal Health's website for more information about these warning signs. If you notice any of these signs or symptoms, or if you have any other concerning questions, you should be evaluated. We recommend using one of the following. You can use My Chart for non-urgent questions that can be sent directly to your doctor. You can call your clinic for any questions or concerns during business hours. And you can call NurseLink at any time, 24/7, for urgent questions at 210-358-3000. Call if you have an emergency so that they can get you help as soon as possible. Regardless of who you call, be sure to tell them, I had a baby on this date and I have these symptoms. This sentence will ensure that they are able to make appropriate recommendations for you. Finally, if you live near our Women's and Children's Hospital, we offer a 24/7 Women's Center for OBGYN emergencies. If you aren't nearby, you should go to the closest hospital. Thank you for watching this video about warning signs in the postpartum period. Please continue to the next video about why it is important to attend your 6-week postpartum visit.